Welcome back to the Resting Stitch Face podcast. I'm your host, Dr. Erin Sheffield,
And Dr. Sarah Harding.
and we are here with an amazing guest, Dr. Tiffany Lamberton. Do you want to introduce yourself, Tiffany?
Yes. Hi. Thank you so much for having me on the show. I am Tiffany Lamberton. We all met at Pinnacle, which was like an amazing women in healthcare conference. So I have dual degrees in physical therapy and dentistry. I live in Tacoma, Washington. I'm obsessed with TMD care, jaw joint, all things dysfunctions, not just helping my patients, but educating other dentists. And so I am just thrilled to be able to be on the show. Thank you so much for having me.
We are so excited to have you on. This is perimenopause podcasting at its finest. So, we just try.
I am having a hot flash right now, so yeah.
Are you? You need like a
It's
fan.
probably just my sweater. It's like weird in between seasons here in Illinois, so anyway.
Yeah.
Yes.
Yeah.
First, I want to say I think it is so cool that you are a physical therapist and a dentist. Like, that is probably such a rare combination. And as someone who has been doing physical therapy myself, I've been doing physical therapy for my pelvic core health after having twins and a 10-pound baby. I will tell you the 10-pound baby is worse for your pelvic floor than twins. But I couldn't believe when I first started that process because she started having me doing weirdest things. Like we were doing breathing, and then I was like breathing and moving my arm, things that seem like they have nothing to do with the pelvic floor. And finally we kind of integrated in, but I was just so fascinated by the process, and it was such a good reminder how systemic our bodies are, including our jaws and all of that. And they even were like, we want to develop a program, a TMJ program and a physical therapy program where we start with the bite and go from there to kind of align the whole body. So since then, I've been super curious about all of that. So I want to hear all of the things from you. I also say I'm one of those people that says I don't really like TMJ, so I'm so inspired by your passion for TMD. Tell us
Can we get
all
a little bit of a background? Like, where are you from? Where'd you train? And then how did you get interested in dysfunctional TMJs?
I grew up in Washington State. My dad was a dentist, and I grew up working at his office. But then he was always like, "Don't go into dentistry. It's terrible. It's so stressful." He always used to call it like, "I'm gonna go work in the salt mines." That's what he was like. So I was just like, oh, okay, well, not dentistry then. And I have a cousin who's a PT who's amazing. And so at the time I went out and shadowed her, and I was like, this is really cool. I've always been interested in moving the body. I rock climb and I snowboard and I ski and I do Pilates. And that just kind of seemed like a natural progression of learning about kinesiology. And so I got into Loma Linda in Southern California. And at the time it was just a master's program. So now they have a DPT, but I got my master's and started to work as a physical therapist. Loved it. I was working here in Seattle. We were treating the Mariners. We were treating some of the professional tennis players. I had an amazing mentor, super happy. And then started dating my husband, and he got accepted into medical school in Loma Linda. And I was like, no ring, no move, bud. Like, I've already been down there. I love Seattle. I don't want to leave. So we ended up getting engaged and got married.
For you.
First and second year of medical school. And so then here I am in Loma Linda again, and I just got so burned out. I couldn't find a job that I liked, and I'm looking at all these kids that are in like dental school and medical school, and I'm like, I think I want to go to dental school. And everyone's like, are you crazy? Why? And I just kind of got on this mission, and I was like, I want to do it. And so I just had to take like a few prereqs, like OChem, and got into dental school at Loma Linda.
So I'm going to ask, how old were you when you started? Because I think that this is a really important thing to talk about, because there's so many that go straight from college, but there's so many also that, and I think that they actually make better dentists.
Oh, everyone called me Mama Bear because I was 30 when I started.
Gasp.
I know. All the kids, they're like 24, you know?
Mhm.
So, dental school was amazing. It was the hardest thing that I'd ever done. I loved going through anatomy again. Like all of pathology was my passion. But then when you start like, doing operative, and I was the one that was getting like a C in operative lab, and I was crying and carrying around my little bag of typodont teeth. It was like, you prep, and the instructor would be like, no, that's so bad. Like, go
Your
do it.
walls are parallel. We don't like parallel.
And
So
then you have
I
to
was
grade
like,
yourself, right?
oh,
So you have to tell yourself how
no.
accurately tell yourself how terrible you were. Is that what you guys
No,
had to do too?
no,
Oh,
we
that
didn't
sounds
Oh,
do
we had
terrible.
to
that.
grade ourselves, and then we get graded on how we graded ourselves. So
Oh, no.
I
you
was
guys
just
went to a
like,
lot easier dental school than I did. So
oh, it was so hard. And so then we have our TMD rotation with the oral medicine person from USC, and everyone's so bored. They're like, oh, this is the worst. Like, all you do is like make splints and do like spray and stretch. I would never do that. And she was actually our oral pathology teacher, and I really liked her. I had like the top grade in oral path. And so, you know, she was like, can you come back and like tutor the class behind you? You know, so like
Yeah,
that
cool.
was always like a strength for me. But actual dentistry was not.
Everybody's
Everyone's good at
out.
So
something.
Everyone has their
I
niche.
know. Everyone
Find
does.
your
And
path.
so, you know, I was really interested in ortho. I kind of like, you know, thought, you know, should I do that? Should I do oral medicine? And my husband was basically like, you just need to start working. You have like so much debt. And
Like,
that's the
you're the
thing.
reason my path changed.
When you're in dental school, doesn't it just seem like monopoly money? You know, you're just like,
Yes.
oh, $200,000, $300,000. No
Oh,
big deal.
man.
I'm going to pay that back. And then all through dental school, everyone was like, you're going to have babies, aren't you? And then like the instructors would be like, oh, you're taking up a spot that someone else could have, because like there's so much
What?
shame. There was so much shaming about women in dentistry. I mean, I'm dating myself. I graduated in 2007. But I mean, when I got in, one of the admissions people was so pro women in dentistry. And her mission was to have at least 50% of the class female.
Yeah.
Bless her, right? And
Right.
now look at us, right? Now look at us.
But I graduated like 4 years later. You know, it's like,
I
wasn't
only
that far
graduated
behind?
2 years later, but yeah, I
Yeah.
mean, it's
And
still
I was in South Carolina. Like, I would think that, you know, California, that's shocking and sad to me.
I know.
Sorry.
I know. But anyway, so, you know, whether I was going to or not was like somebody's business, you know, but like instructors would ask you all the time, you know, and you're like, no, of course not. Of course not, you know. And so then
Right.
I took my boards. I was working as a PT in between, like waiting to find out
I
if I
love that.
passed. I passed. I got my first job, and then I got pregnant. Like a month in, I had my white coat and I didn't want to tell anybody, so I hid it for like 5 months. My patients didn't even know, I think, until I was like 8 months pregnant,
Oh
because
my
like
gosh.
I was like, didn't want to tell anyone. And so then I had a baby, and then I was like, I don't want to go back to work. No, but I had to, right? I'm sorry, I'm just really in the weeds with my story here.
I love
But
it. I love it.
but you don't know how you feel when you have a child and all of a sudden everything's different. And
Mhm.
those days, my husband was a chief resident in urology. So he was gone. He was working 110 hours a week. It was me. I was like, you know, breastfeeding in between patients, and I would drop the baby off at the nanny, and it was like 10 minutes from my office, and I would cry all the way to my office. And then you
Yeah.
did it, right? And so then he finished residency. The plan was always to move back to Washington, because our families are here and we're both from here. And so I worked some, but I was just fortunate enough working part-time off and on. And then we had another baby. And again, I tried to work when he was little, and it was so hard. And like a year in, I was like, forget it.
Yeah.
I can't do this. And so I'm so lucky enough to have like an amazing supportive spouse. And I was able to take some time off when the boys were little. And then when my youngest started kindergarten, one of my friends was like, hey, do you want my job? I'm going to be moving to a different office. And I was like, yeah, I think I do.
Cool.
So I started doing restorative 2 days a week. And I told the dentist that I was working for at the time, I was like, I'm really into TMJ. Like, this is my thing. I've been doing a lot of study clubs and continuing education, and had always had in the back of my head, I want to start my own practice, but just felt like I wasn't brave enough. And so I said to him, what if we brought in TMD and airway into the practice? Because it was a big, busy practice. There was 3 high. They were really good about screening. And so I started to do less and less restorative and more TMD. And so it really gave me a chance to kind of look at the medical side of it and like, what does billing look like? What is it like to do oral appliance therapy? Not everybody's a candidate for it. So there was a lot of like good learning during that time. And then COVID hit. And I was supposed to be like a teacher for my kids,
Yeah.
So our office was closed down for 2 months, and I'd like go take a shower and come back down. And my little 6th grader was doing his Zoom meetings. And then my 3rd grader would be like laying across like 3 different chairs and hacking and doing cat memes into the PowerPoint presentation, and, like throwing balls at the wall, and, like fidget spinners would be flying, and like,
Yep. I understand.
right? And it was just so hard for everybody, right? And, just trying to juggle, kind of being like the primary caregiver and, not that, I have a supportive partner, but I just think for women in dentistry, it's so different, right? Like either you have to have like a village in order to work full time. And then if you're working full time, you feel so guilty. Like you're missing the tennis mat,
Everything.
whatever. And that was a really hard time, I think, for me. And that's when I kind of started thinking, should I do my own practice? Should I jump out there? And then I met Jessica Emery. Do you know Dr. Emery? So I met her online, and I was like, I want to have a podcast, and I want to have an educational platform, and I want to write a book, and I want to do this and that. And so that was where I started TMD Collective as an educational platform. And I also started.
I bet she was so excited about your energy.
Yeah.
Right?
Well, you guys know online is like a whole other thing, right? And you could start a podcast, but it doesn't mean it's going to make money.
Right.
So I have Jaw Talk, but it's not making any money.
Yeah.
And
We're
so
making
then,
a lot of money here.
oh, are you? Okay,
So
yay!
much.
Then I need to hear your secret.
So
That's
much
why I was
money
hoping
making
we
so
would
much
talk
money.
about that. Yeah.
in our dreams.
Yeah.
Dream money.
Monopoly money.
So I started a TMD practice of my own, did it for 3 years, and just failed fantastically. And so I just shut that down.
Interesting.
It's okay, right?
Yeah.
It's because I feel like TMD is this weird area between dentistry and medicine where it's not really well covered. Dentists don't want to touch it. General dentists don't want to touch it. They just want to know where to send the patient as quickly as possible. I feel like oral medicine is there, but like it's just a part of it. And a lot of times they're not looking at kind of like you said, the whole body, like the
Right.
vaginal planes, and like, they're like, well, I don't want to touch the neck. Well, like, they have like a, SCM spasm on one side. Like, I'm sorry, I'm a dentist. Like, I just do
Right.
teeth,
Right.
So,
Yes.
kind of that sort of holistic view is very rare to find, I would say, in dentistry. And so I'm still finding my way.
When I was out of dental school and I was in residency, or maybe I was just out of residency, and I was talking to one of my friends who was our mama bear. And she was in practice, and she'd been in practice for probably 5 years. She'd done an AEGD and everything. And then she was like, you know what? I have finally started looking at the patient as a whole patient and not just as a mouth. And she's like, I can't believe it took me this long. And it was like a light bulb in my head. I was like, that's the difference.
Yeah.
That's the difference between like what we do and what just going through dental school teaches us, because we learn about all of the systems, but we don't
Put it all
really.
together.
We don't
Yeah.
put it all together. We do systems-based learning, right? And so you're learning about the kidney and you're like, oh, glomerular filtration rate. Yes, I understand. But you're not learning about like all of how everything is is talking to itself. And so then you go into private practice and you're like, well, you've got a cavity on number 19. We're going to fill that. Or, oh, you keep fracturing off this cusp. Well, we need to figure out how to, not have that happen. And
Mm.
but it's not like the systemic, holistic thought process.
Well, and I'd love to talk with both of you just about like the oral surgery piece of it. I know, Sarah, you have worked with Dr. Larry Wolford, and I feel
Mhm.
like within the oral surgery world, it's like, where did you go to summer camp? There's like some people that want to operate on the joints. Some people don't just want to do orthodontic. Some people just want to take out thirds. And, it's just like, there's only about 8,000 of you in the US. And so
Yeah.
even trying to find an oral surgeon that even wants to operate, even arthrocentesis or total joint replacement or, autologous fat grafting, even to find someone who is willing to offer that surgical treatment to your patient. I find it's like West Coast, East Coast, like we
Right.
need more West Coast people, right?
Yeah. Yeah. And it's
So,
interesting because even having the training that we had, like we're scared away of it too. You know what I mean? Because so off, like how many times have you operated on a joint in residency? And like it's never not never, but like so many times, like it's just a slippery slope, like you have one procedure and it may not have been like really truly what was going to help, but now you've got scar tissue, you've got all of these other issues. It's a slippery slope. And so I think that's what's really scared us away, is just the lack of evidence. And even working with Dr. Wolford, I mean, like things happen and work with his hands. It's magical. And I can do exactly the same thing and it would probably turn out different. You know what I mean?
mhm.
And so there's just gifted people, but I think that needs to spread. You know what I mean? And I love what you're doing because I think that it's bringing a lot of awareness, and it's such an opportunity.
Yes. Well, and I think also as diagnostic imaging becomes more part of our practice with cone beam CT, where you can see the airway, you can see the joints, MRI, I'm like such an advocate for early recognition and diagnosis, especially our young female patients before they even start like phase 2 ortho. I would love
Mhm.
to have better diagnostics with the general dentist and the orthodontist, because the problem is like most of the patients, the pain patients that I see in my practice, they're already like 30 to 65, right? And so the disc is already displaced. They may have already perforated their retrodiscal tissue. They may already have condylar volume changes, and their condyles look like the little like high-heeled shoe or like a little bird beak. And so you're already telling the patient like, okay, we recommend this type of conservative therapy. And, these are the tools that I have in my toolbox. But not everybody's going to get better with conservative care.
Right.
Sometimes there's going to be times where people need surgical intervention. And I really feel like we need to bring awareness to that younger patient population. So in my intake, I always include a question about like, 0 to 10, did you have any trauma? Did you fall on the chin and split your chin open, or like concussion, or like you fell off a rope swing? Or, we have all these little girls that are gymnasts, and you start to see in the skeleton that like they're not growing or developing. It could be asymmetric with one
Mhm.
side versus the other. Maybe one joint is more damaged than the other. And so you start to see that on your panos and your CBCTs is, oh, like one joint looks kind of bad compared to the other. Well, like, what
Yeah.
are we going to do? And so I think the thought process has always been, well, let's wait till they're 17 or 18 and do orthodontic. Okay, but what about the joint? I love Dr. Gunson, but he's just like, I don't do joints. Kind of like Bill Arnett, like that West Coast thing. And like, again, I believe in like airway and like, I think that like, yes, we do need to pay attention to the airway and that's part of it, but like you can't ignore the TM joints or just like expect them to be like little sticks and then like ask the patient
Yeah.
to survive on that,
Right. And
so
then if you have damage to one, Well, and then you're creating this, it's one bone, right? It's one bone articulating in two places. And so it's like if you've got an asymmetry, like the damage in one is going to create issues on the other side as well, because it's going to be remodeling, trying to compensate and that sort of thing. And so it's never just an isolated issue. There's always going to be compensation. And then people are getting these asymmetric clicks and this pain and swelling, unilateral swelling, and they can't understand. So let me ask you this. So for young girls, let's say my friend calls me and says, "Hey, my daughter fell off of these swing set and hit her chin. She's having some pain over her left TMJ. And she says her bite's a little bit off, but it seems like it's better today." What would you recommend at that point?
An acute, like where you're just
Yeah.
trying to do like soft food diet and like ice and maybe like Tylenol. I mean, I think to me, the key really is your diagnostic imaging, right? Because especially in those young female patients, you could take a cone beam CT and you're like, no, the joint space looks good, the condyle looks good, you know, because there hasn't been a lot of bony changes at that point. But I think that's where the MRI specifically of the TM joint and really accounting for, you know, the condylar correction, both in the sagittal and the coronal. And so that's been the whole thing for me. As so like I had to go to Reyes Radiology, and I'm lucky I've got like an amazing neuroradiologist, Dr. Pillai, who's very familiar with like imaging in different positions, not just like open and closed, but also like bringing them to like an edge to edge position and seeing like what does the disc look like, or like if the orthodontist is going to be bringing them forward, let's say like a functional appliance or herbs, you know, do they have disc coverage in that forward position? And so to me, the MRI is kind of like a crystal ball, and it just helps guide the
Yeah.
treatment.
I think in that acute situation, they're just like, "Hey, is everything going to be okay?" And I'm like, "I don't know." Clearly, if the bite was off, you maybe have a little hemarthrosis, you maybe have a little something. And so in that immediate time frame, my initial like brain will think, "Well, we need to work on range of motion. Like we need to keep motion through there so that we're flushing out all of the inflammatory cytokines and all the inflammatory mediators and allowing the joints to move so that they're not getting so they're not stagnant and allowing for that inflammation to take hold." That's kind of my thought, because, okay, well, now her bite's kind of back to normal, but then all of that inflammation is now already seated and taking hold. And then that's like what you're talking about down the road, where we start to see the manifestations of that
Breakdown.
anatomically. And so I'm just wondering if there's something that we can do in the immediate time frame
Yeah.
that will help prevent some of that. And I just
That's a
don't
great
know.
question. And I would say with like the collateral ligaments, with medial and lateral collateral ligaments, a lot of times the lateral one will get stretched or torn, but there could still be disc coverage on the medial pole. And so in that case, you're trying to just kind of support that. And so a lot of times if it's a young kid like that, I'm either just doing a really flat plane appliance just to try to unload the joints, but also kind of keep everything even and supported. But again, if the orthodontist is planning for, you know, a lot of class 2 correction, I'm going to want to know that I have that safety and security of disc coverage in that forward position. And same thing with orthognathics too. Like, where are you going to be building them? You know, where are you going to be putting that? And can the joints support that position? And so
Right.
I think it's really exciting because like Siemens Healthcare is coming out with dental dedicated like MRI. And I
Oh,
think that's
wow.
always been the barrier for general dentists is they don't know how to order it. They don't know how to talk to the radiologist. They don't know how to interpret it. And then what do you do with that information? And so to me, I want to build, I mean, when I kind of envisioned TMD Collective, the educational platform, really to teach other dentists how to do this, right? Like, how do you diagnose your patient? And then you have a system, and then it's not scary, right? Because that image that you have, that's data, right? It's like a sleep study, right? It's like,
Right.
this is what you show the patient and the parent. Like, you know what? We see in the image that your child's disc is dislocated in this position, but if we move them into this forward position, they have disc coverage, and we feel like that's going to protect the growth center of the mandibular condyle. We're going to treat them and support them in that position. So whatever type of appliance, you know, whether it's a printed appliance or like, you know, Dr. Drew McDonald, who's an amazing orthodontist that has like just been such a mentor and amazing to me, like he's planning his orthodontic cases based on imaging. So,
Yeah.
whether it's, again, it's like, what do you want to do that correction, that class 2 correction in your hands? Is it a removable? Is it fixed? Can those joints support that position? And so I think that's the key thing, is early recognition, early diagnosis, and then that's going to direct your treatment. Because with physical therapy, we can only do so much, right? So, if you have a disc that's completely dislocated in front and it's like a little doorstop, and that your patient can only open, 20 millimeters, I'm thinking already,
Right.
this patient going to do long term. So I think back to your scenario with your young child is, get them first of all out of pain and out of that acute things with what you were saying, and really supportive. I mean, I love a freaking aqualizer. It's so easy,
I don't even know what that is.
Oh,
Me
it's
neither.
I have some in my cabinet.
We don't like to say that.
Oh,
We're oral
okay, I'm
surgeons. We don't like to
I
say
know.
we
Okay.
don't
Well,
know.
it
really
has
good
I have no
I'm really
brand
good at that.
endorsements with this company.
Yeah.
They're on Vashon Island, and I wish I
I'm
had.
really happy to tell
I
you
wish
all
I
the
got
things I
a
don't know.
10% discount. But no, it's like a little. It has little water things that a patient can just rest their teeth on. It's just like a day splint. It's like a resting day
Wow.
splint.
Wow.
That just helps them with their bite, and just kind of when they're in that acute inflammatory phase, or if they're waiting for imaging, it can be like a tool, and it's super cheap. And
Oh,
so
very cool.
All right, well, looking it up now. Sounds like a
Can
day at the day spa. Aqualizer.
Right.
right, I know.
Aqua
Maybe
spa.
we should just make our own, right? Maybe that could be
Right.
the next thing.
Yeah.
New business idea.
New business
There you
event.
go.
Yeah.
My mom says she's going to this retreat. She says it's relaxing and getting massages and sitting in classes all day. Honestly, that sounds like the most boring vacation ever. Plus, she says no kids are even allowed, so basically it's like zero fun.
Should we say something about the doctor's on? You could say something like, sign up if you love boring things like naps and
Sign up if you like boring things like naps at the doctorsallin.org. Out.
Can we talk, Tiffany, about delayed diagnosis, delayed treatment for TMJ, specifically as TMJ being a problem for women? I think the data would show, I don't know what the numbers are, but most TMJ patients are female.
It's 9 to 1. Yeah.
Right? Okay. I thought it was something close to that. But I remember I had this aha moment in residency. All the TMJ cases that get on the schedule, it was always oh, this crazy TMJ patient, they're so crazy. That was always a narrative. And you go in and you see the crazy patient. And it took me a few years of residency to kind of realize this is interesting, because all of the diagnoses that we chalk up to being crazy tend to be the ones that happen to women. So I'm thinking TMJ, that's the crazy. For my husband, ENT, it's the vertigo. You've got the fibromyalgias. You got the endometriosis. There's all of these. And I started realizing, isn't this interesting that the things that are kind of hard to explain, kind of hard to diagnose, kind of hard to treat, when they only happen to women or almost always happen to women, then it just gets chalked up
Dismissed.
to this crazy,
And
right?
doesn't it give you vibes about Dr. Mary Claire Haver's keynote speech at Pinnacle when she was talking about the whiny white woman? Is that what she said?
Right.
And I was
Yeah.
oh gosh, we have that in dentistry too. I mean, it was such an aha moment to me to hear her say that. And I'm like, oh, wow, we have that.
Yeah. And that's our TMJ patient. And you think of how many times, I'm sure you guys see this too, how many times these patients come in and they're borderline tearful or maybe full on tears. And it's I've been dealing with this for XYZ, and I've been bounced from my primary care to my dentist to my ENT and to physical therapy and the chiropractor
and acupuncturist.
Yeah. And so
and they're on
all
multiple
of those,
anti-depression, anti-anxiety medications, multiple neuromodulators.
Yeah.
happen.
What do you think? Do you have any thoughts on that? Um, there's so many different ways you could choose to go. We could talk about the patriarchy of medicine. We could talk about discounting women. We could talk about why we think it happens more to women, or if you just want to talk about that. But
To me, it's almost like a simple orthopedic issue, right? Like if you had a torn medial meniscus in your knee, would you ever be dismissed? I have boys, they're 14 and 17. They're tennis players, they're snow skiers. They've had some injuries. And it's like, would you ever, if you'd injured your knee and gone to the orthopedist, would they ever say, yeah, no, like you have
Stop
torn
whining.
knee. Yeah, we're not going to do an X-ray. We're not going to do an MRI because that wouldn't change what we're going to do. It's all in your head. Just like go home and, maybe take, like you said, like an antidepressant because your pain is all in your head.
Yeah.
right.
And it's like, no, it's like, why are we ignoring these joints, right? And why are we so hesitant to take imaging just to get the diagnosis, right? It's like I've seen thousands of MRIs of the TM joints, and I'm always amazed where you see like the disc where it's like floating in like the little lateral pterygoid muscle. Like that disc is not going to recapture. Like, it's just like you have an orthopedic injury and you need to treat it like that. And sometimes it's going to take surgery. Sometimes it's going to do that. And so
and also it's not like a broad brushstroke of everybody gets an appliance, because so many times I have patients come to me after they've been in this appliance that their dentist made for them because insurance pays for that appliance, and it's made them worse.
Yeah.
And they tell you that, and they're like, but I don't like to wear it because every morning when I wake up after I have it, it's like way worse. But I keep wearing it because they say that I need to. And you're like,
right. Yeah. Yeah. And that's why I feel like even just cone beam CT is not always adequate. There's times where we need to get more information about the soft tissue. And you need to have, in my opinion, for some of these patients, MRI directed splint therapy or orthotic therapy, because it's like you have that patient that comes in with their bag of appliances. They've tried the NTI and they've tried the flat plane, and it's like, why are we guessing? And I've literally had patients where they were put in an anterior repositioning appliance. Their disc was off just enough, but like the posterior band was just clinging, and basically they were loading it with their appliance. And you had 9 months later, you had condylar breakdown. You saw swelling on the MRI, like condylar edema, and then you saw condylar collapse. It basically becomes like an avascular necrosis, so it depends on the disc. Where is it at? Is it where it's supposed to be? Is the joint getting the blood supply that it's supposed to? And so do you know that your appliance is actually helping? And so I think that's what's so hard, is because you get all these people that are like, oh, DTR, or like this, my appliance is best. And it's just like, it's not a cookbook, right? And like, we would never treat any other joint in the body like a cookbook without the diagnosis. You would never treat a rotator cuff tear or a labral tear. That part of it as a physical therapist is just galling, that like, why are you so afraid of getting a diagnosis? But I mean, like, I've had peer-to-peer discussions with insurance companies. Like, they're like, well, why do you need an MRI of the TM joint? And then they're like a dermatologist. And you're like,
well,
okay,
for me,
who am I talking to?
listening to you say that, it's kind of an aha moment. Like, it's so dumb that it would be like, oh, it's an anatomical problem. We should treat it like an anatomical problem. But for so long, we've treated it as a psychological problem. And I think my TMJ strategy with my patients, I'm not personally doing TMJ surgery. I didn't feel super well trained in that. And I feel like it's kind of complex, and I want my patients to go to someone who really knows what they're doing. But I do a lot of screenings and, conservative management and help find the right person, which I still think is valuable. But the strategy that I have, and my staff hates the 4:00 TMJ patient, and I kind of do too. They're my longest appointment.
Oh, yeah.
It takes me like an hour.
Mm.
And I'm always typing all this stuff. But I realized the reason I do it this way, I just kind of subconsciously developed this. I go through a really big, long list of questions and history and all of that. And we get a Panorex or a cone beam. But most of the time, I get a piece of basically scrap paper and I just start drawing pictures. This is your TMJ. This is anatomy. This is the disc. It's supposed to do this. It's supposed to move here. Yours isn't moving here. It's called ADD with reduction. Sometimes it goes to without reduction. This is what it means. I'm drawing pictures.
Yeah.
That's
And then
not
I'm
attention
making-
deficit disorder. That's anteriorly displaced disc. For
That's
those of you
right.
listening that aren't up on the
And then
link.
these are the things we start with. We start with number 1, NSAIDs, and number 2, soft diet, and maybe a splint, and blah, 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 blah. And my staff's like, don't you want us to just print that paper off for you so you can have it and just give it to them? And first I'm like, yeah, that would save me a lot of time. And then I'm like, no, actually, that's what they're paying for. It's me listening to them and then telling them they're not crazy. And that is 90% of what I do. You have an anatomical
Same.
problem. This is what's going on. This is its name. And here are some steps that we can follow to try to address it. And it's always like, oh my gosh, thank you, doctor. But so for me, it's kind of annoying. It takes a long time. Yeah, I could be way more efficient and effective with my time.
Productive.
But
Yeah.
it's for the first
And you're probably
time,
getting like
probably.
$80 for like your time too.
Yeah,
Right.
exactly. It's the worst hour of my life, effective wise, billing wise, but it's worth it because
It
they're
is.
seen and they're heard and they
Mhm.
know that they're not crazy.
Yeah.
And that's so sad that we do that to
Yeah.
people. And honestly, we do that mostly to women.
Yeah.
I have this
Well, and-
other problem where sometimes I feel like it's not, there's some sort of physiologic anatomic, there's an issue, but I feel like it's a sequelae of something else, right? It's the same, it's the patient that has migraines, that has pelvic floor dysfunction, that has, endometriosis or adenomyosis, that has this intense life stressor that's happening right now, compounded on top of this chronic life stressor that's always happening, and not sleeping or not sleeping well. And it's this whole thing. And when you do your exam, normal opening, maybe a little bit limited because guarding, and no click on opening or closing. There's some deviation, so there's clearly like an anatomic thing. But to me, in that case, like there's so much other stuff that we need to get under control before we can even get to this part, because I feel like if you've got this like underlying, overwhelming systemic inflammation that's just pervasive in your life because of all of these other things, like your body, even if I do the best surgery for you, can't heal because you have so much inflammation that it's like trying to fight every war in the world and now heal from surgery. And so that's to me where it's important to have the conversation first to start understanding like what all is going on and plan forward for how can we do this, and like what order can we go about this in? Because I'm not one to just jump into surgery because I don't think that if the body is not in a place where it can heal, I'm only going to make you worse.
Mm-hmm.
And so
Well,
what do
and
you-
I think that's where interdisciplinary care is so important because there are times when we need to bring in ENT, or there are times where we need to address the airway issue, or even bringing in like a sleep study. But I think the general dentist should be the one driving the treatment, and that we should be the one reaching out to the PT. Hey, here's a patient I'm working with. They've elected to do conservative care. This is the condition of their disc. Like usually you're like, okay, well, like they have arthritis, this is their cone beam CT, and the PT's like, cool, like, but
Yeah.
I mean, there's just, and even with like the myofunctional therapists too, right? Like they're so eager to like do their exercises, do their things. Well, like I don't want them doing like a peanut butter rub on my patient that already has a displaced disc, and then you're shoving the condyle back again with your exercises. So to me, I feel like as a general dentist, it's on me to educate my team and to coordinate the care of my patients with all of these other people because, yeah, I've got a lane, but I know enough about a lot of other topics where I can bring in, my specialists, so that's what I'm trying to establish both in my community of like the people that know what I'm looking for and what I want. And so that I know when I send my patient to them, or if they have any questions that they're going to come to me. Right. And so
Right.
I really feel like it's setting the stage for the patient. Like, hey, we're really going to take care of you. This is a complex problem. We're going to need an interdisciplinary team. I'm going to send you to this person. They're going to take care of this. I'm going to send you to this person. They're going to take care of that. And I think that's how we solve, some of these complex problems is because I think our colleagues on the medical side, they are desperate to have people like this. Like my husband's a urologist and he's like, for them, it's interstitial cystitis. And he's like, if I had someone like you who would just take my patients, my really, like you said, your 4 o'clock patient that takes up all your time and it's going to need a lot of like the PT, pelvic floor therapy. They're going to need this. They're going to need a bladder diary. He's like, babe, you're gold, like you just need to clone yourself.
Yeah.
Please come to Quincy,
Yeah.
Illinois.
Southern California. Hey.
Well, see, this is why I think we need to build our coalition, right? We need a care center of where we have oral surgery, we have ENT, we have the physical therapy, we have the general dentist and the restorative dentist. It's like I don't want to do fillings and crowns. And if you've done surgery and like you've changed the bite and that patient needs onlays, like that's not me, but I'm happy to send you to someone who's really good at that. So
Yeah.
I think,
And I think mostly it's an education thing. I mean, really,
Yeah.
because we all know the anatomy, but we've all just been like, we don't know what the problem is, and it's not always the same problem. And so we have been, because we don't know the answer, we're dismissive. And so, and that just propagates the same problem. And
right.
so, like, just the education behind it, I think learning about all of these things that you're talking about, because I'm just like soaking it up, because I'm like, yes, I've seen that. Ooh, yes. But it's not my everyday thought
Right.
processes. And so to hear you say it and put it all together, I think it's enlightening and it's what we need, because I think everybody hides from the TMJ, and especially from when there's dysfunction, because it takes time. It takes deep dive, but it doesn't have to be that way. And I think with the education that you're doing, I wish that we could get you out so that everybody has the TMDR on call, right?
So tell us
But I
then
mean-
what you are doing with the TMD Collective.
Yes.
What kind of things are you offering? How are we building
can
this
we-
coalition?
yeah,
Like, can
yeah.
you offer to us? Because even as we're talking, I'm so on board, but I'm like, I don't know anything about making splints. Like every once in a while I do, but I just kind of hope this
Well,
helps.
Last
Yeah.
September, I did my first Women in Dentistry CE retreat, where it was 2 days of CE. I brought in 7 speakers. We did Pilates. We did private shopping event. We did wine tasting. We did the fun thing of bringing together, the oral surgeons and the endodontists and like the general dentists. And like, we all need to be talking to each other more. And so to me, that was like fun. It was a lot of work. I need more money. I know you've done some retreats and you've seen like the good and bad of that. I just got my AGD number and I would love to do more educational events. I think that what I'm seeing from the younger dentists, they don't want to just go to like SmileCon and roam around the exhibit hall and like boring.
It's
Like
so
you want to have these niche CE experiences where you have a chance to ask your questions. You're like, well, what's your practice like? Or like, hey, I have this front desk person, like I have this problem. What did you do? Right. And so I think there's definitely some groups that are out there that are doing some amazing women in dentistry things. I'm lucky because we have the Coy Center. So what if we had like
The
that?
Lamberton
But like,
Center.
yeah.
no, it doesn't need, I don't even want my name like that.
Airport
I mean,
transfers and Lamborghinis.
like TFT Collective, because really about like learning and collaborating with each other, right? Because like you guys know so much about your field, and I'm just in awe of like your skill set and what you do every day. Yeah, yeah. I mean, own it. Look at you've built
I'm like,
this the skill set. I mean, you sweated and strained and worked through dental school, residency, so like you're it and you're the next generation. And so as I talk to younger dentists that are just getting out of dental school, they don't feel prepared. They're in so much debt. They want to, just like not go to like CE that is not applicable to them. They want to have these settings where their questions can be answered, that they can interact with specialists, that they can, where we can be generous with our knowledge, right? Because like I
Right.
feel like people that like mentored me, I had so many stupid questions. But it was like, if you can ask it in a way that you're like, put your hand up, like, wait a minute, what about this? What about that? You know what I mean? Like, I want to build those kind of educational events for dentists that, really nurture, especially like the new grads, maybe the grads that are like out 5 years and they're like, I want to kind of niche down. I think the myofunctional therapy community is hungry for
Absolutely.
mentoring. Like you've got speech pathologists, you've got
Yeah.
PTs, you've got people that want to work together. But they're just like, we don't know what you guys know on the dental side of it, and so to me, when I kind of was like, I want to build an educational platform, it wasn't really for patients, because I do think there's a lot of Facebook groups and stuff like that that are kind of more for patients. Mine is really, I want to be for dentists, and helping elevate our people.
Yeah, just by knowledge and level of care that you're able to offer.
Yeah. So I just
Right.
need like, Melinda French Gates to like give me like $5 million.
I mean, let's start manifesting.
That's
I
right.
know, right? And what
Yeah.
about Mackenzie Bezos,
Yeah. I can sell a lot of avocados, but I can't get you there,
But see, this is why like I want you guys to bring the surgery part of it. We
Mhm.
need more surgeons. We need more surgeons that like can diagnose, that can
Right.
recognize it
Because
and then
really when it comes down to it, like the general dentist is sending them to us. And we get
Mhm,
the consult for joint pain, jaw pain, TMJ
Headache.
pain.
yeah.
And it's like, and so we need this too, because even if I'm not going to treat you, if I can do the diagnosis and I can figure out what the problem is, then I can send you in the right direction, whether
Right.
that's something that's non-invasive or something that you need surgery for.
Right.
And
I
so,
think too, a part of it, at least for me, and you kind of hinted at, is not just that educational experience, but having that mentor or that
Mhm.
community where you can be vulnerable enough to say, hey, I don't feel super comfortable with these patients. Or maybe I figured out this kind of group of patients, but I don't really know how to choose a splint, or I'm not really sure which surgery is the right option.
What
Having
about
those
Botox?
people,
Like, is
right?
that going to help? Or like, how much? And like,
Mhm.
where do I put it? And like, yeah.
But
Right.
sometimes you don't have that person you can ask, or maybe you don't want to show your vulnerabilities, or, you want to maintain face that, I'm an expert and I know, and sometimes it's kind of scary. So to admit that maybe you do have those gaps, but I think creating a safe spot, I think that's kind of the
Yeah.
new, at least for me, new age of where I want CE to go. I want it to be a more intimate, personal opportunity where I'm not just wowed and impressed by all the academic things that people are doing, but
Mhm.
things that are actually going to help my patients day to
Yeah.
day.
Right.
I don't just need to see your successes. I need to talk about our failures too,
Yeah.
right? Because we can't get
Yeah.
better if we don't address those.
Well,
Like
and I feel like
you're,
we need like a women's health initiative too to make this like affordable for patients, because there are
Mhm.
patients that need surgery and it's like $40,000 or $50,000. And then if that's not covered by insurance, or insurance has decided that TMD doesn't matter, and we
Which a lot
also
of them
need
do.
this massive grant to like train the oral surgeons that are going to do the surgery, train the general dentists, train the, physical therapist that's working together with like the post-surgical care, all of the neck stuff, all of the, myofascial stuff, and I think kind of creating like a center where like patients can like fly in, I don't know. Maybe you have that in like Southern California, Sarah. Do you have like a TMJ wellness center that like they're
Oh,
getting
maybe.
operated on, and like I don't know who
Yeah.
are like the gurus
I don't
down
know.
in,
They haven't
in
reached
your.
out to me yet.
They haven't. Oh,
Maybe that's next week.
next week. Next week.
Okay. I
They
did miss
got
the
the wrong
Game
call.
on.
number. Yeah.
Game on.
Strange. I don't know.
I
But
don't
yeah,
know,
I
but
like
like
the idea though.
if
Yeah.
you had an oral surgeon that was like so kind and nurturing and was like, I'm gonna come out and I'm gonna train you. So this is like really putting you on the spot.
It is.
I'm gonna set you up with the whole system, and then you're gonna get all of these like West Coast patients. Would you
Right.
do it? You know,
Right.
right? Yeah. I mean, you have to make money at it too, right?
You
And you have
do.
to have a
Yeah.
passion for it, right? So yeah.
Yes. Yeah.
Yeah.
And as we all know, like having worked with Dr. Wolford, like Dr. Wolford just was like, the way that he would talk to patients, like we would always joke about it, but like the way that he would talk to patients, he was such a patient, kind soul. You know what I mean? And so you have like, there's a certain type of person that's able to see these patients and meet them where they are and get them to a better place. And there's just a lot of people that don't have that.
Yeah.
And so I
And
think
we have to
it's,
get paid for our time, you know? I mean, we have put a lot into our education to getting, where we're at in our careers. And so we can't just like have like it be like a $35 office visit, right? Like, I
right.
mean, there has
Do you
to
mean
be
we're supposed to advocate for ourselves and our worth? That's weird.
Well, I think it needs to be a fee for service model, but then again, all of a sudden, then you have this whole like then you're limiting who can get care, right? And
Right.
then it becomes that systemic problem in our society that the vulnerable people can't afford care.
Yeah.
There's only going to be like then a subset of patients that can afford it, and
Right.
that's where I get really stirred up about
Me too.
cutting
Yeah.
benefits and insurance and Medicaid, and I mean there has to be something where we can treat the vulnerable people in our society as well, because when you've seen a 3-year-old with decay on every single one of their primary teeth, they're going to need sedation, they're going to need this and that, and you're going to take that away. I mean, I get emotional about this because it's like, this is not this kid's fault, right? Like they're in their situation, they're in their circumstance,
Mhm.
and you've taken away their lifeline and their ability to
Mhm.
get oral health care.
Yeah.
Just,
Definitely.
what are we doing? What are we
Yeah.
doing? Just like in like my kids and my avocados, and like I'm not ready to solve like global systemic problems yet.
Tomorrow.
Sarah's
Tomorrow,
always
tomorrow.
ready. Yeah.
Get me tomorrow. Yeah.
But yeah,
No,
like
but I
how
agree. It's
are we going to make this affordable and accessible for our patients? The patient that's crying in your chair, Erin, your 4 o'clock patient. How are we going to make that so that they can get care? We have to have a system that is predictable, where you get paid for your expertise and your time, and that is a way that brings in this interdisciplinary care that patient so desperately needs.
in the last I don't know, since finishing dental school, I do feel like there has been a bigger push and more education and understanding of the oral health connection to the whole body, to the systemic
Yes.
body. And so I feel like that's what needs to be established first before we can, because I just feel like we're not taken seriously. They're like, oh, your TMJ hurts. Oh,
It's just like they put you all together in like one table, and like in the corner, they don't really know what to do with.
Yes. Oh, there's 3 dentists here. That's so cute. They're going to talk about
Yay!
cavities.
You call the
Yay!
cardiologist. I had this patient that had aortic stenosis, which is very dangerous for anesthesia, and they're like, cleared for dental surgery. Go right ahead.
Yeah.
And I'm like, I'm not doing that in my office. So I'm asking like the anesthesia people. They're like, we're not doing that in the surgery center. That's like going to the hospital, to the ICU. But they're always just like, dental surgery, it's going to be
Right.
fine. I'm always like,
Yeah.
the mouth bone's connected to the body bone. The
Yeah.
mouth bone connect. Like it's all
Right.
Your pelvic floor might actually affect your TMJ. It's crazy. It's all connected.
100%. I know. And
Mm-hmm.
the opportunity to do a head and neck cadaver dissection with Dr. Tamimi. She's an oral maxillofacial radiologist, and just the refresher of like the fascial planes and like the
Mm-hmm.
just like you're just like, yes, this is why our patients, like, we can't just like be like, oh, I'm just like treating number 19. It's like we've got
Yeah.
to pay attention to all of those connections. Yeah,
We're getting there.
we're getting there.
Yeah.
We're going to take over the world, though. I
Well,
feel
we
it.
all know
I feel
that.
it. Yeah.
Why do you think we're doing this podcast?
Right. So, Erin, when's your next retreat?
Our next retreat is happening February 27th at the Miraval in Austin. So
Okay.
it's going to be awesome.
You coming to
I-
speak to us?
I want to come.
You should come. Sign up. We want you
Yes.
there.
Okay.
We want you there.
You have a
It'd be great.
wealth and a breadth of knowledge that is, I think, vastly undershared.
For sure.
Yeah.
For
Yeah.
sure.
Yeah. Do you have like a number? Are you trying to get general dentists, or is this more like specialists?
The retreat is geared toward women oral surgeons, but anyone who feels called to come is welcome to come. So we would love to have general dentists, other dental specialists, other women doctors, surgeons, all of that. So most of the content will be applicable to anyone in healthcare, but our niche
love
is more oral
that.
surgery. But anyone who wants to come is welcome, and we'll have a great time, I think.
I know. I mean, it should be like warm in like February, right?
Mm-hmm.
That's the whole point.
Maybe. I feel like we always got ice storms in Dallas in February. I thought it
We're
was like
hoping.
Yeah.
It's a little bit of a gamble, but it should be great. Yeah.
Yeah.
And the massages are warm. The spa is
Oh,
warm.
that sounds amazing. Yeah.
Yes.
And it's
Well,
heartwarming to not have to have your phone on you all the time.
Yes, right. That's the problem as a content creator. I'm like trying to get video and they're like, put your phones away. But I gotta make
No.
content.
That's
Anyway.
amazing. I know I had a woman, Catherine Preston came in. She's a cleft and craniofacial orthodontist, and she gave this amazing keynote about like women supporting women and like, why are we tearing each other off the rungs of the ladder? It's like,
Mhm.
we should all be helping each other like rise. We we
Yeah.
already have it like hard enough with like living in our
There's
world.
nothing that frustrates me more than when a woman tears down another woman. Like, it's just like such a gut punch to me. Like when the person harassing
Same.
you at work's another woman or that kind of
Same.
thing just gets my goat, as they say, more than just about
Right.
anything. So, well, thank you
Yeah.
so much for
Yeah.
joining us, Tiffany.
Oh,
Yes,
It
thank
was
you
thank
for
you so
amazing
much.
talking to
me.
you.
It
I've
was
been
so
dying to have these
fun.
conversations with you, so I'm just so glad.
I
I'm
love
sure
both
we
glad.
could
of you.
have more deep dives into all sorts of topics that we just kind of touched
I
on
know.
preliminarily.
I
So,
know.
if our listeners want to find you, what's the best ways to what's the best way to get into contact with you or to find you online?
Yeah, so I probably am the most active on Instagram at TMD Collective, tmd.collective. I also have a website, tmdcollective.com, which also needs to be updated, but you can certainly find like contact information, or you could email me at drtiffany@tmdcollective.com. I will
Awesome.
respond. I'm a good responder.
Good to know. Thank you so much. It's been a pleasure.
Yes. Thank you. Thank you.
Good
We'll
luck
talk
with
to you
everything.
soon.
Thank you. Thanks for listening to another episode of The Resting Stitch Face. If today's conversation spoke to you, imagine what it would feel like to connect in person. That's exactly why we created The Doctor Is All In, a retreat just for women in oral surgery. Learn more and grab your spot at thedoctorisallin.org. We'll see you next time.